Let's go to Professor Peter Collignon again, who joins us from Canberra to get some analysis of what's going on in Victoria. Thanks for joining us again, Peter. It's very important for us to work out exactly what's gone on in Victoria, what measures were successful, what were unnecessary, because, of course, we might be dealing with this outbreak or other outbreaks in years to come. To your mind, looking at the data, what have you learned about the measures imposed in Victoria and which of them were most effective?
Well, I think if you look at their epidemic curve, it started turning around the time that they had their stage 3 lockdown. But I guess you could also look at the upside and say, well, why did it go up so much? And it was fundamental things like people being close together at home when there was a lot of infection there, contact tracing not as good as it was. I think it was not allowing people readily to know which places and workplaces had infection. And I think it was in essential industries, such as nursing homes, such as hospitals, where staff were close together in tea rooms, handover rooms, where you were getting a lot of infection that way as well. So I think we need to learn from all those things, because it's not only relevant for Victoria, it's relevant for all of Australia, because, it's got a lot of implications. This virus, I think we're going to have to live with for another 2 or 3 years. We've never eliminated a respiratory virus until we've had a vaccine that's 95% effective or 90% effective, such as measles, German measles. And so that's not likely to happen anytime soon. I hope I'm wrong and we get a vaccine, halfway through next year that does that. But realistically, the only place that's really tried hard for elimination was New Zealand. It didn't work. Victoria had quite harsh lockdowns in March, April, because they were going for elimination at one stage as well. Again, it didn't work. So I think a long-term suppression therapy gives us elimination, but then we don't expect it's going to last. We just have to keep on taking the precautions, which I think is the sensible way forward. Have people do as much as they can, but realise the virus might be around and do what we can to decrease the risk.
Now, the contact tracing we've looked at in detail in the past. Obviously, Victoria is looking to lift its game there. You've got to be really on the ball then. Part of that is public knowledge, alerting to people where the outbreaks are. When you look back then, you talk about stage 4 and, stage 3 having things starting to turn down on the infection curve. What about the curfew? Is there any evidence that either the curfew or the keeping students away from schools have slowed the spread or contributed to turning down the curve?
Well, I think when you have a lot of infection, hundreds of cases per day, anything you do to decrease the movement of people will have some effect. But how much effect that would have had compared to the other things you did is one of the things we do need to dissect out. I mean, a curfew itself doesn't stop infection. What stops infection spreading is not having too many people at home mingling together, not having people in bars, clubs, or even in the workplace. Now, the curfew probably made it easier for policing, and you can see who's on the street and who isn't, but in itself doesn't do anything to stop the transmission. This transmission is predominantly by droplets, and therefore people with symptoms are the ones who are most likely to cause infection, and it's people close to others, a metre, metre and a half, even 2 metres, particularly if people are coughing a lot. That's where you've got the infection. And so it's the physical distance, the hand hygiene, keeping away from others who are sick, makes the big difference. Children can get this and can spread it, but they do it much less, particularly children, primary school children. They seem to be much less frequently both get the disease and spread it. And it may have something to do with the receptors you have in your nose and your upper airways. Why children have less of these ACE2 receptors than others is not clear. 17 and 18-year-olds might be as much of a risk as adults, but there's no doubt that I think 10-year-olds are much less of a risk, and therefore primary schools in particular, if there is not a lot of community transmission, it doesn't seem to be sensible to close them.
Absolutely, and you've been consistent on that for at least 6, 7, 8 months on this program. Peter, just briefly though, compulsory masks. They seem to make sense on public transport in crowded places, but for people walking around the park and the like.
Yeah, look, I think mask is an issue. I think as the New South Wales Premier and the Chief Health Officer there said, it's about number 6 or 7 on what you can do to decrease the risk after all those things I mentioned before. And I think to some degree, people are wearing masks think, hey, the problem's over. But a lot of this transmission is occurring in people's homes and in the workplace where there's not necessarily always masks worn. So yes, they're a good idea, but only if you can't do the basics, which is physical distancing. And if you're outside sitting in a park with people you're living with, I can't see what value masks are. And the same as, walking around or playing golf or something like that. that doesn't, to me, make sense. And the trouble is, if we have to do this for a long time, we need to have things put down that make biological sense and are plausible. And so getting people to have restrictions where you say, well, you know, if I'm fishing by myself, do I have to wear a mask? Just doesn't make biological sense.
Indeed. Thanks for joining us again, Peter.
Thank you.
Professor Peter Collignon there from the Australian National University.